Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello, and welcome to this week's episode of the podcast. As always, it's a real pleasure to have you along for today's episode. Today is all about the Botox or the Neuromodulator Experience. While I have done podcasts in the past on Botox 101, if you will, today is really about the experience and what you can expect when you come to the clinic for a treatment. Because it occurred to me that patients, in some cases, did not know what to expect, particularly if it was the first time that they were getting a neuromodulator treatment. And so that is the topic of today's episode. We're going to cover what can you expect, how can you get ready for a neuromodulator treatment, and what is it going to be like when you enter our clinic until you have that needle injecting the Botox. Okay, so let's get right to it. A couple of terms that I'm going to be using, and I've already used in this episode, is neuromodulator. Neuromodulator really is the generic term for Botox, Dysport, Xeomin, Nuceiva. These are all the brand names of a neuromodulator. And Botox has often become the default term, if you will, kind of like the way Kleenex has become the default term for facial tissue. But technically speaking, they are neuromodulators. So if you hear me refer to neuromodulators, if you hear me refer to Botox, if you hear me refer to any of the other brands, Nuceiva, Dysport, Xeomin, they all mean the same thing. Okay, so let's get right to this. What happens in a neuromodulator treatment? Well, first thing is you contact the clinic and you speak to the staff about what your concerns are. They will talk to you about what is the best way to book this, how much time you need, when would be a good time to do it. Something to consider is if you have any major events coming up, you don't want to do it right before the event, within a day or two before the event, because a number of reasons. First of all, it does take a few days for the neuromodulator to kick in, and for the full effect, it can take about a week to 10 days. So if you want to have the effect of the neuromodulator for this event, it makes sense to do it at least a week to 10 days in advance. The other thing is, as with any injection, there's a chance you could get a small amount of bruising. And although it's very rare, we don't want to have you with a small amount of bruising for this event. So our staff are extremely knowledgeable. They're going to help guide you through when and how and with who would be the best person for you to have this treatment. Once you've scheduled that and you come in, then we start with the greeting, because that's really important to us at our clinic as well at Anti-Aging. When you get there, we want you to feel very welcome. We want you to feel comfortable. And again, particularly if this is your first time, we want this to be as stress-free and enjoyable as possible. So you will check in. We have a lovely waiting room, a relaxation room we call it, where you can sit, you can get a drink of water, coffee, tea, etc., and just relax until it's time for your appointment. Then we move you up into one of the treatment rooms, and one of our staff will speak with you, and they will take some pictures, because it's really important that we have the before pictures so that we can compare to the after pictures, and that way we know if the treatment is done to your satisfaction, if we need to touch up anything. The pictures are extremely important for us to track how we are doing, because we want this to be a long-term partnership with you as well. At that point, once they have done the initial assessment and the pictures, you will then speak with the healthcare provider who is going to be performing the treatment. If it is me, then I'm delighted to chat with you, to meet you, to learn about you. One of the things that I really enjoy learning about is actually why you're there. Like, why did you decide to come in and get the treatment? Because I think that's very interesting, the psychology behind it. And it also helps me to understand a little bit more appropriately why you're doing it and what your goals are and how we can achieve those goals that are best for you. Because I want this to be very personalized. If you haven't listened to my 5 pillars of my medical aesthetics practice, then please go back and listen to the previous couple of podcast episodes, because I talk about the pillars that I believe in when I do my treatments, and one of those is personalized treatment. So we'll talk about that. Then we will get into questions. Because it is a medical procedure, I do need to take a medical history from each and every patient that comes in, and that includes your general medical health. Do you have any ongoing medical conditions? Something in particular that can be relevant to neuromodulators is if there are any pre-existing neurological or neuromuscular diseases, because this would be one of the reasons that we would not want to do the neuromodulator treatment. So that's one of the things that I ask you about. I ask you some specific questions about that. I ask you about some medications that you're on. Blood thinners would make you more prone to a little bit of bleeding and bruising, so we would discuss that if you are on any blood thinners. And it's also good to know other medications that you're on as well. Something that's very important for women is to ask if you are pregnant or breastfeeding. Studies have never been done to check if the neuromodulators have any effect on a developing fetus or a child that is breastfeeding. However, interestingly, there have been some anecdotal circumstances where a pregnant woman was getting neuromodulator treatments for migraines, and there was no issue at all with the baby. So it is very reassuring. It is unlikely that a neuromodulator would have any effect on a fetus or a breastfeeding child. However, the studies have not been done, and so if a woman is pregnant or breastfeeding, we cannot do that. Once we have gone through the medical history, then we turn to the actual assessment of the face. At that point, I like to learn again which parts of the face are the biggest concern to you so that we can focus on that and we can make sure that the neuromodulator treatment is done in the right area. In order to assess that, we need to have you make certain facial expressions because the neuromodulator really affects the muscles underneath the skin. And when those muscles contract, that's what creates those wrinkles that we're trying to treat. And so in order to assess that, we need to see those muscles working. So I may ask you to lift your eyebrows up. I may ask you to frown. I may ask you to give me a big smile. I may ask you to clench your eyes really tightly. I may ask you to flare your nostrils. I may ask you to pout or to wrinkle the skin in your chin. There are various different types of facial expressions that I may ask you to do, and those are all to help assess different muscles in the face. Once we have a look at that and we can see how strong each of those muscles are, then we can decide on the dosing of the neuromodulator. Because again, it's personalized, it's customized. It's not a cookie cutter approach. I don't just dose everybody the same. Everybody needs an individual dose of the neuromodulator. And that's the way we decide that. We look at the muscles and then we make those decisions. So that's what we would do. We would then map out where we're going to put the different doses of the neuromodulator. And then we go and we prepare it. We prepare the neuromodulator in these tiny little syringes with tiny little needles. They're in fact the same needles that people with diabetes use when they're giving themselves insulin. They are tiny. If you know the size of needles, these are 30 or 31 gauge needles. They're very, very small. And then we come into the treatment room once those are all prepared, and we do whatever we can to make you more comfortable. That may mean using some ice. It may mean distracting you. Sometimes conversation can be the best distraction. It means sometimes pinching the skin as we do the injection. But nevertheless, with these comfort measures in mind, we then administer the treatments. Once the treatments are done, which by the way, take very little time, it literally takes a couple of minutes, if that, once we've done the whole assessment. The assessment by far is the longer portion of the process. Once it's done, we make sure that there are no little areas of bleeding. If there are, if you happen to have a little bit of area of bleeding, of course, we deal with that. We put a little pressure there until that has stopped. Again, it's quite rare. And then we talk a little bit about the post-care, which involves not going into a very hot environment for the rest of the day, not doing any vigorous activity, trying not to massage the face, and trying to stay upright for a couple of hours. And that's just to prevent the neuromodulator from moving to another area that we don't want it to move to. And then that is essentially the basic process. Then, as you may know, neuromodulators last for approximately 3 months. And then on the way out, if you would like to, we then book your follow-up appointment 3 months out. However, I will also say that if you are new to the clinic, we often like to have you come back about 2 weeks after the initial appointment so that we can reassess how you're doing once the neuromodulator has kicked in, and then we can determine if we need to do any little touch-ups or discuss any aspect of the treatment. There you go. That is essentially the neuromodulator assessment and treatment that is done in the clinic. I love doing these treatments with patients, and if this is interesting to you at all, or you know somebody that may be interested in going through this process of the assessment and the treatment with myself, then of course feel free to contact me at antiagingvancouver.com or on my own website at drterifisher.com. Thank you for tuning in. I hope that answered a lot of your questions. I hope that was informative. And I always have fun speaking about the neuromodular treatments. It's one of my favorite things to do. So with that being said, I hope you have a wonderful week, and I will talk to you again very soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.